I'd like to call this meeting of the Fiscal Committee to order. I would like to ask everyone in the audience to remain quiet so that the committee may conduct their business efficiently. This meeting is being live streamed. I ask the committee to utilize your microphones anytime you are speaking, both for the benefit of our remote viewers and for the people here in the room to hear you. Overflow rooms are available for the audience to view this meeting. They are located in rooms 202, 204, and 205, 207, which are down the hallway on this floor. They will have a live feed of this meeting on a television. Again, thank you for being here today, and please help us get through our business by remaining quiet throughout the proceedings. Please be sure to turn your phones to silent or vibrate mode. Thank you. Our first order of business are the minutes from the September 17th meeting. We had a correction to those, and I believe that has been made. Could I have a motion to accept the minutes?
So moved.
Do I have a second? Okay. Senator Gaida moved and Senator Rosenwald seconded.
Point of order.
Yes?
Should the motion not be to approve as amended?
As correct? Yeah, as amended.
Thank you.
Okay, thank you. All those in favor signify by raising your hand, please. 1, 2, 3, 4, 5, 6, 7 in favor. Opposed?
I'm not opposed, but I was not here at that meeting, so I abstained. I was
Oh,
not voting
okay.
at that point.
All right. 7 in favor and 2 abstentions. Now we move to the October 22nd, 2021 meeting. Okay, Senator D'Alessandro makes a motion to approve.
Second.
Second by Senator Gaida. Are there any comments, questions? Seeing none, please raise your hand if you're in favor. 9 in favor. Opposed? None. Okay. This is tab 3. The Legislative Performance Audit Oversight Committee has made a recommendation to us for approval of a performance topic: licensing, processing, and procedures for the mental health workforce. This is at OPLC. So, can I have a motion to...
I would so move, Madam Chair.
Thank you, Senator Gaida. Senator Gaida moves and Senator D'Alessandro seconds. All those in favor, please raise your hand. One, two, three, 4, 5, 6, 7, 8, 9. 9 in favor. Representative Edwards, are you voting or not? Yes? Okay, thank you. 10-0. Okay, on tab 4, there has been a request to remove FIS 352. This by Senator Rosenwald. So if I could have someone from HHS come forward.
Madam Chair,
Yes?
Do we need to have the door to the hallway open? There's a lot of noise.
Excuse me, if you want to hear, you can go to room 202. Okay, excuse me just a second. You might try room 205, 207. Okay. Senator Rosenwald, you had some questions on this?
I did. Thank you, Madam Chair. This question applies to both this item and the later item, the late item. My question is, who sees the test results both within the state, and does the federal government have access to any test results as well?
Thank you, Senator Rosenwald. Who sees the results? So the way these work is you have a take-home test. You do a saliva in a little tube. You spit in the tube. You send it back in a sealed envelope, and it goes to a laboratory. The laboratory processes it and then notifies the individual of their result. The Department of Health and Human Services is also notified. It is a communicable disease that is one of the diseases, COVID, that gets reported directly to us. That's how we do our case counts. These are not reported to the federal government as identifiable tests, but we do submit aggregate data.
Senator Gaida?
Thank you, Madam Chair. Does the department maintain individual data on each of these tests as it comes back positive?
Correct. Yes, we maintain individual data. We maintain individual line lists, much like we do with the other lists of reportable communicable diseases to the state.
Thank you.
Senator Daniels?
Thank you. How are these tests administered? Are they on a voluntary basis where somebody would have to ask for it, or is the department going to be out there promoting it through schools or some other medium to get to the people?
Great. Thank you for that question. So these are completely voluntary. No one is forced to take a test. We are making them available potentially in places like schools so that people who are, children who have symptoms, or even beforehand, parents can have that so that it's ready to go. If their child is symptomatic, they can do the testing in the convenience of their own home. The way it works is you get a little kit. You may have the option of doing a Zoomed visit with a healthcare provider, but you don't need to do that. But if you have questions on how to do the self-administration, how to spit in the little tube, it offers that ability to have someone walk through that with you, but you don't have to do it. And then, as I noted to Senator Rosenwald, you pack up the test, you put it in an envelope, you send it to the laboratory, then the laboratory notifies the individual of the result.
Thank you.
I understand the problem with the sound in the remote rooms is that we are not talking close enough to the microphone to be heard. So if you could set your microphone on the side of your book and speak directly into it when you want to speak. Are there any further questions on FIS 21352?
Move the item.
Okay, thank you. All right, Senator Rosenwald makes the motion, and Senator D'Alessandro seconds.
Madam Chair, I had a question.
Oh, I'm sorry. Excuse me.
Thank you. Will there be any efforts by the department to promote testing through the schools?
Well, we will certainly make people aware that that option is open, but schools, this is also voluntary on the basis of the schools. The schools do not have to participate if they don't want to. We similarly have other very voluntary testing processes that we do through schools, but districts make that decision for themselves.
Thank you.
Okay. Would the clerk please call the roll? Move the mic. Oh.
Okay, this is a motion to approve on 21-352. Representative Edwards.
Yes.
Clerk votes yes. Representative Erf.
Yes.
Representative Leishman.
Yes.
I'm not close enough. I can't read and talk at the same time. Okay. Senator Daniels.
Yes.
Senator Morse.
Yes.
Senator Gaida.
Yes.
Senator Rosenwald.
Yes.
Senator D'Alessandro.
Yes.
Representative Umberger.
Yes.
Madam Chair, the vote is 10 in favor.
Vote is 10 in favor. Thank you very much. Could I have a motion to approve all of the other consent items in tab 4?
Move.
Senator D'Alessandro moves. Senator Rosenwald seconds. All those in favor, please raise your hand. 10-0. Thank you. We now move to tab 5. Tab 5 is FIS 21334. All right, could I have a motion to approve this consent item?
So moved.
Thank you, Senator Gaida. Second? Senator D'Alessandro seconds. All those in favor, please raise your hand. 10-0. Thank you. Tab 6 is one item on consent. 384, FIS 21384. Do I have a motion to approve this item?
So
Madam
moved.
Chair, is it 348 or 384?
348. 21348.
Sorry. 21, dyslexia right here. 21348. All those in favor?
I didn't have the motion.
Oh, I'm sorry. Senator Gaida, did you move that motion?
No, I just called the,
Oh, okay.
I move them.
All right. Senator D'Alessandro, do I have a second?
second.
Okay. Senator Daniels, seconds. All those in favor, please raise your hand. 10-0. Tab 7. In tab 7, the Department of Education has asked that they withdraw FIS 21322 and FIS 21323. And Senator Rosenwald asked that we remove 325. No?
Oh, it was, I'm sorry, Madam Chair, it was 336. Department of Health and Human Services.
Okay, that's fine. I had both of them, but
Oh,
okay, so we will not remove 325.
it wasn't me who wanted to.
Oh,
I
okay.
don't know if someone else did.
I don't think so.
Okay.
Okay, so 336 is Senator Rosenwald asked to remove 336. Okay, so could I ask HHS to come back to the table? Good morning. Could you please, which I didn't do last time, state for the record your name?
Karen Rounds, Chief Financial Officer, DHHS.
Thank you.
Commissioner Lori Shibonette, DHHS.
Henry Lippman, Medicaid Director.
Thank you very much. Senator Rosenwald?
Thank you, Madam Chair. Good morning. I understand these are the extra federal Medicaid match funds. And my question is, last fiscal department lapsed tens of millions of dollars of general funds that were supplanted by this extra federal money. Is the department planning to do that again this fiscal year or considering doing so?
So we don't purposefully try to lapse these dollars. We did try to accept what we could estimate we were going to receive last fiscal year. One of the issues that I have still not been able to resolve financially in the department is estimating revenue. We are finally at a place that we estimate expenditures extremely well. Every area of the department does it the same way, but revenues are a little bit more complicated. We just started a process to issue an RFP to be able to do that better in the coming biennium. So I can't tell you for sure that we won't still lapse some revenue, but we are attempting in the best way that we have available to us right now to estimate the enhanced FMAP and accept it into the budget.
Yes, go ahead.
Thank you. So on the expenditure side, though, the Medicaid caseloads are still really high because of the extended public health emergency. And did we account for that in our budget? Did we appropriate enough to cover all of the extra spending, which would allow you to lapse this revenue?
So no, we appropriated the additional expenditures through 12/31, I believe, and so that's why we're accepting these funds, which are creating an appropriation to continue to pay for those additional members.
Thank you.
Are there any further questions? Seeing none, clerk, I need a motion. Okay, thank you. Senator Rosenwald.
I didn't have my microphone on.
Yeah, that's okay. Senator Rosenwald makes the motion and Senator seconds. You need to call the roll. Yep.
Okay, this is a roll call for FIS 21-336. Representative Edwards.
Yes.
Clerk votes yes. Representative Erf.
Yes.
Representative Leishman.
Yes.
Senator Daniels.
Yes.
Senator Morse.
Yes.
Senator Gaida.
Yes.
Senator Rosenwald.
Yes.
Senator D'Alessandro.
Yes.
Representative Umberger.
Yes,
Madam Chair, the vote is 10-0.
thank you very much. 10-0. Could I have a motion on to approve the remainder of the items in tab 7 that are on the consent calendar?
I would move the items.
Senator D'Alessandro,
Second.
seconded by Senator Rosenwald. Am I going too fast?
No,
Okay.
so far,
All those in favor, please raise your hand. 10-0. Thank you. We now move to tab 8. Which is FIS 21-342. Could I have a motion to accept 342 on the consent calendar?
Move the item.
Thank you, Senator D'Alessandro. Do I have a second? Thank you, Senator Rosenthal. Okay, all those in favor of moving FIS 21-342. Please raise your hand. 10-0. Thank you. We now move on to tab 9. Tab 9 is FIS 21-341. Could I have a motion to accept this on the consent calendar?
Move the item.
Thank you, Senator. Do I have a second? Representative Leishman? All those in favor, please raise your hand. 10-0. Thank you very much. Okay, moving on to tab 10. Representative Umberger has asked for the removal of FIS 324, Department of Education. Would you please come forward? Hi, could you please state your name?
Good morning, I'm Mackenzie Snow, Division Director.
Sorry, just pull the microphone towards you and speak directly into it.
Thank you, Representative Umberger. I'm Mackenzie Snow, Division Director of Learner Support at the New Hampshire Department of Education.
Tammy Valancourt, CFO for the Department of Education.
Thank you very much. My question was, how are the non-public schools going to receive these dollars?
Thank you. So I think for context, it's helpful to understand that this is a second iteration of the EANS program. EANS 1, or Carissa EANS, what was just recently administered. And under there is a second tranche of funds called ARP EANS. So it will be administered substantially similar to Carissa EANS. The non-public schools that are selected to participate must demonstrate their eligibility and proactively apply. They must demonstrate their eligibility by showing a substantial proportion of students who are low income, as well as a significant impact of the COVID-19 pandemic. The agency submitted an application to the U.S. Department of Education with metrics for these two criteria, which was recently approved, and we received the funds on 10/25.
So the non-public schools will in fact have an application process that they need to go through?
That's correct.
Okay, thank you. Could I have a motion? Oh, I'm sorry.
Thanks, Madam Chair. Could you tell us how many schools are likely to receive these funds?
So there were 48 non-public schools deemed eligible and chosen and who chose to participate in Carissa EANS. But again, their eligibility is based on their self-reported data in their applications. So that gives us a guidepost, but that number could be different for ARP EANS.
Thanks. Thanks, Madam Chair.
Are there any further questions? Senator D'Alessandro.
Thank you, Madam Chair. First of all, thanks so much for coming. But it seems there are a couple of things here that make me
Senator
think.
D'Alessandro, please
Am I-
move. Well, you're on, but you're not close enough.
No, you just,
Okay.
you're good.
There are a couple of things on here that give me pause because of the fact that they're an ongoing expense that's going to have to be maintained. For example, improving ventilation systems. Those are going to have to be maintained over a long period of time. Are they not?
So that is an explicitly federally allowable use. And of course, these funds are only available for obligation through the end of the performance period. So they're federal funds. When they run out, they run out.
Okay. And that's the same situation with leasing additional space? I mean,
Yeah.
it seems to me, once you've made a decision to lease additional space, isn't there a contractual relationship that's usually associated with that extends over a period of time? Or is all of this done on an annual basis?
So that period of time must be within the performance period, and for ARP-EANS, that's through federal fiscal year 24. So the space that you indicated is very uncommon nationwide and in New Hampshire in particular. It's typically to facilitate for social distancing in classrooms, but again, that could only be utilized through the performance period. In Carissa Eanes, we saw the vast majority of expenditures around items like PPE, things to improve air quality, et cetera.
Okay, but just one further question.
Certainly.
But these things have an ongoing situation. And if you've made a commitment to do it for a limited time, what happens when that time runs out?
So if there are additional needs in response to the COVID-19 pandemic after the performance period of ARP-EANS expires, then those would not be supported by existing federal funds.
Thank you, Madam Chair.
You're quite welcome. Are there any other questions on 21 through 24? Yes, Senator Gaida.
Thank you, Madam Chair. Thank you for your excellent presentation, by the way. Thank you. Is this the same program or a program equivalent to it available to our public schools?
So this is a separate program from that serving public schools. So in the first package, CARES, in 2020, there was a requirement, as there is with ESEA programs and IDA programs, for public schools to provide equitable services to non-public school students and teachers from their allocation. In Carissa and ARP, the Congress decided to create a separate program that is directly administered by state education agencies, as opposed to having a proportionate share of the non-public schools allocations spent on participating non-public schools. And in fact, I think it's helpful to note that school districts in the state have received over $540 million across 6 different programs and these 3 different legislative packages.
Thank you. Would it follow up?
Consistent with the feedback that we've received from school districts.
Thank you very much.
Are there any further questions? Seeing none, will the clerk call the roll, please?
Madam Chair, this is item 21-324. Representative Edwards.
Yes.
Clerk votes yes. Representative Erf.
Yes.
Representative Leishman.
Yes.
Senator Daniels.
Yes.
Senator Morse.
Yes.
Senator Gaida.
Yes.
Senator Rosenwald.
Yes.
Senator D'Alessandro.
Yes.
Representative Umberger.
Yes.
Madam Chair, the vote is 10 to nothing.
Okay, thank you. FIS 20, no, that one's not off, excuse me. FIS 257. Represent, or 3, thank you. 357.
Yes.
Senator Rosenwald.
Yes, I would like to remove it.
Okay, no problem. Could someone from the Gopher office please come forward?
Hello? Yep. Good morning. Hi, Senator.
Would you please introduce yourself?
Taylor Caswell, the Governor's Office for Emergency Relief and Recovery, sorry.
Yeah. Make sure you speak directly into the mic because...
Yes. Understood. Yep.
Okay, thank you. And?
Chase Hageman, Deputy Director at Gopher.
Okay, thank you very much. Go ahead, Senator Rosenthal.
Thank you. Madam Chair, I have a number of questions
Certainly.
on this item, if you'll indulge me.
I will.
Thank you. First, I'm curious how you arrived at the amount of 17 million and change. How did that number?
Certainly.
Up.
Senator, I think what we were aiming for is to be able to launch a pilot program where we would see somewhere between 1,000 and 1,500 students take advantage of a program such as this, and that total comes to around $15 million, roughly speaking, because there would be an average there. And the remaining funds would be used over the course of the 3 or 4 years of the program to administer the program.
Thank you. And I noticed that you propose to allocate a portion of the funds to individuals who are most affected. And so my question is, why only a portion? What portion, and why not 100% being the portion?
Certainly. I think that the idea that we had with this program was sort of twofold. One is to put the bulk of the funding, so let's say I think it was $10 million, that would be eligible for individuals who are at 80% or lower of the area media income. And that would be the first component of the program that would be launched and made available. The second remaining amount of roughly, let's say, $5 million would be launched later in the summer, and the target would be students that are graduating this coming spring, and giving them incentive to stay in the state and take jobs with New Hampshire employers.
Thank you. And what are the industries that you're proposing to run this program in, and how are they arrived at?
So at this point, this program is seen as sort of a foundational component of our workforce recruitment effort. And so we have not specifically designated any industries or any sectors here. We're aware of the fact that there really is no industry or sector in New Hampshire that is not experiencing a labor shortage right now.
Thank you. So you're probably aware that we have a state loan repayment program that we allocate general funds to for healthcare workers. This budget appropriated about half as much money to it as the last budget, but we could serve all the requests. To what extent will healthcare get the money that you're proposing?
Well, I think the healthcare industry probably is among the most impacted industries right now, obviously, in the state as it relates to being able to recruit and retain workforce. I do think that this would be a very popular program for those industries. I'm also aware that this is foundational in nature, as I had mentioned. There are, I think, other opportunities to continue to find ways to specifically target industries such as healthcare. But we've sort of brought this forward in a pilot sort of format in order to be able to determine the workability of this and the effectiveness of it before we started targeting specific industries.
Thank you. But this is one-time money, isn't it?
That's
the
correct.
17 million, so it's a pilot, but how would you propose funding it on an ongoing basis? If 1,000 students or 1,500 students cost $17 million once?
Well, I mean, Senator, that would be part of the ongoing policy decision-making that we'd all be making looking forward. This is something the legislature has looked at in the past in previous iterations, a version of this type of program, and whether that is worthy of ongoing additional federal investment, assuming if because the ARPA funds are still available through the end of 2024, if we wanted to make more investments of those funds, or if we wanted to find some availability of in-state funds to continue that program, that's a decision that we would all have to make at that point.
I have two more questions,
Okay,
if I could.
can I hang on?
Yeah.
Hang on just a moment. Ma'am, I'm sorry, there are nothing can be raised above your head. It doesn't matter. It doesn't matter. Thank you.
Thank you, Madam Chair.
Go ahead.
Thank you. How long a work commitment are you proposing? Will it be similar to the state loan repayment program?
It's 4 years would be the total commitment under the program.
Finally, how are you going to measure success? What specific parameters do you have?
Well, I think first and foremost would, of course, be the number of employees that are still in the program at the end of the program. I think it's a pretty common assessment in the workforce area that if you're able to hold on to an individual for a period of 3+ years, generally their inclination is to stay with that employer or in the area that they're in. So that's a little bit of the thought process there, and we'll see, or when we get to the end of this, where things stand.
Thank you.
Are there any further questions? Yes, Representative Leishman.
Thanks, Madam Chair. And just to follow up to Senator Rosenwald's question, you say in here, and I was a little puzzled by your response, that you're not quite sure who may be administering this, but you point out that you intend to partner with another agency or entity. Could you tell us who that might be?
It's Business Finance Administration, BFA, would be the administrator of this program.
Okay. Thank you, Madam Chair. Thank you.
Are there any further questions? Yes, Senator Gaida.
Thank you, Madam Chair. Could you go into some depth about what you mean by disproportionately affected by COVID?
Well, I can let Chase get into that a little bit more, but it has to do with the federal eligibility components of the funding that we're using for this program.
No, press the red button.
Try it now.
You're good. Just
Hello?
press it once.
Okay,
You're
there
good.
we go.
Yep.
Senator Gaida, yes, the disproportionately impacted standard is established by the American Rescue Plan Act, and the targeting of this fund to those at a certain percentage or lower of the AMI helps meet that criteria.
Follow up?
AMI meaning adjusted median income.
Area median.
Area median, okay. Follow up?
Yes.
So what we're establishing here is an incentive based upon income?
I mean, the commissioner can also jump in, but I think it's an incentive more focused on student debt relief needs as opposed to specifically income. It's just meet certain requirements or eligibility standards for use of these funds. It's called upon entities or states like ours to have requirements or areas of focus like this when using these funds in this fashion.
Follow up?
Yes.
Thank you. So,
excuse me, could you move your microphone closer? There seem to be some issues with hearing. Okay, thank you.
Thank you, Madam Chair. So, supposing a person takes these funds for a year or two of college and then decides not to finish, is there any mechanism in place to claw those back, or have we just wasted the money?
So I think the details of the program, some will be worked out with BFA as we move forward, but the current thinking is to not necessarily advance funds before reaching certain milestones of work eligibility. So the hope would be to avoid having to claw back funds based on how the program itself would be structured.
Thank you, Madam Chair.
Senator Daniels.
Thank you. Just want to express some concerns that I have. And Commissioner, I know that you were part of a study committee a couple terms ago, over 100 training courses. I go around now and there are help wanted signs everywhere.
For employers. This program is specifically designated towards the latter. What we're hoping to be able to do is attract students, people who have received certifications or degrees, either here in New Hampshire or elsewhere, to come here and take jobs with New Hampshire employers. In order to get these funding, you have to demonstrate that you've taken a job with a New Hampshire employer, and that you've been able to, and that you've stayed in that job during the term of the benefit. So it's aimed at specifically getting people here to fill a lot of those jobs. And when we look at the demographics, the long-term sustainability of a workforce, there is obviously an inclination towards people who are at earlier stages in their careers. So that's sort of the thought process with this particular program. I know on the training stuff, you and I have spoken about that over many years. There may be some programs that we are able to design and bring forward, and we can have that discussion at that point as to how we want to handle that in sort of concert with other programs that are already existing in the state.
Follow up?
Yes, go ahead.
In finance, we seem to have an unwritten rule that we do not use one-time money for operating cost.
Yeah.
The money that you're talking about is basically a 4-year program, and then people go. So where is the sustainability in keeping people in that job if you're not going to go back to the federal pool or the state pool for more money to supplement what an employer is giving?
Yeah, true. I think that the point, though, is that, and what we expect with this program, is that we would see obligation of these resources pretty quickly. I think that it would be a popular program to be able to help students and adults in a lot of cases offset or reduce the debt load that they're carrying in exchange for taking a job for a period of time in New Hampshire. I would expect that most of these resources would be used up before the end of 2022, and that we would just be managing the program as it is right now going forward over the next 4 years. As I mentioned to Senator Rosenwald, if at the end of that period of time, it's the decision of all of us to continue some version of this, we would have to find resources that are available to us to continue it or not. But there wouldn't be any ongoing cost necessarily beyond the reimbursements that would happen in processing those reimbursements for the people who apply for and receive the funding in 2022.
Okay, one final question.
Yes, go ahead.
So why should people be entitled to student debt relief now, but those who graduated, say, last year or the year before, or those who are graduating 3 or 4 years from now, won't be eligible for it?
Agreed, and this is one of those programs where we absolutely cannot design a program that's all things to all people. I think what we're trying to do is demonstrate that a program that has a student debt relief component to it tied to a work requirement in New Hampshire would provide enough of an impetus to get somewhere between 1,000 and 1,500 new non-existent workers into the state employment system.
Thank you.
Okay, are there any further questions?
Senator Guida.
Oh, I'm sorry, Senator Guida.
I'm over in the corner here, Madam Chair.
I know. Well, you had your chance before, right?
Thank you. So a question as to why businesses themselves can't provide incentives to employers. It seems to me as though with this program, the government is stepping in to pay the costs that businesses traditionally pay for recruiting their own workers.
Mm-hmm.
And for that reason, I'm prone to object to it.
I think that may be the case with a lot of employers. A lot of larger employers I am aware of are doing some pretty substantial things to attract workforce, including relocation costs and so on and so forth. But I don't think that's universally the case with all employers in the state. And a lot of our employers are, as you well know, Senator, smaller employers who may not have the resources at this point in time, given what we've been through over the last year or so, to be able to make that investment, but they still need the resources. They still need that staff as a resource to continue to advance their business. So at this point, it does seem like it would be a good moment in time, if there were one, to make an investment such as this.
Yes, you may.
I would submit that we have a 4-year or a 2-year training program that an employer has a need for an employee now,
Mm-hmm.
that this is not going to help the situation it's intended to based on the COVID pandemic, which we expect to end at some point. So there's a disconnect for me in 4 years or 2 years down the road, paying for a college or an associate degree or a technical degree for a need that's now that an employer will benefit from 2 or 4 years down the road.
Well, just to clarify, this would be for students right now, and they would enter the workforce, and then over a period of 4 years, there would be a reimbursement on an annual basis to those employees or to the debt holders for that in exchange for their employment.
Final question.
Yes.
So what do we then tell those who attempt to qualify and don't? That because for some arbitrary reason, you're going to have to pay back your college loan, but because we chose somebody, they're not going to have to.
Again, this is a program, and one of those programs where there's probably not enough money in terms of student debt that's out there right now, particularly in New Hampshire, to cover every single dollar of that debt.
Senator Rosenwald?
Thank you, Madam Chair. I don't feel that I have enough information to vote on this item one way or another, so I'd like to move that we lay it on the table and ask the department to, or Gopher to come back at the next meeting with a fleshed out plan, including sustainability projections.
I'll second the motion to table.
Okay. Senator Rosenwald moves to table. Representative Edwards seconds. All right, you ready? Okay. The clerk, call the roll, please.
This is a roll call on 21-357 for a tabling motion. Representative Edwards.
Yes.
Clerk votes yes. Representative Irf.
Yes.
Representative Leishman.
Yes.
Senator Daniels.
Yes.
Senator Morse.
Yes.
Senator Gaida.
No.
Senator Rosenwald.
Yes.
Senator D'Alessandro.
Yes.
Representative Umberger.
Yes.
Madam Chair, the vote is 9 to 1 to
The
table.
vote on FIS 21-357 is to 9 to 1 in favor of tabling. So, could I have a motion to accept the remaining items on the consent calendar under tab 10?
Move the items.
Second.
Thank you. Senator D'Alessandro moves. Senator Rosenwald seconds. Thank you very much. I'm sorry. All those in favor, please raise your hand. 10-0. Thank you very much.
We have a late item in that tab. 21-361.
I think it's in the next tab. Mr. Kane, is
Yes.
the late item in tab 10 or tab 11?
There are no positions, so 21-361 is a request of $8 million of ARPA funds for the purpose of
Right.
testing.
But is it?
You could take it up now if you would like, because it is appropriate.
Okay. Okay. All right, we will, yeah, yes, we did vote on the consent calendar, right?
Yes.
Okay,
Yes.
thank you. All right. FIS 21-361,
Correct.
okay?
Move the item.
It's the late item?
It's the late item, yes.
And we're going to take it up now, Madam Chair?
Yes. They decided that they wanted to do it now. It's currently located in your books under tab 11. Okay. FIS 21-361 is from the Department of Health and Human Services. And the purpose of this is to respond to public health emergency or its negative economic impacts. Are there any questions for the department?
Madam Chair, you're saying it's in tab 11, and I don't have it in tab 11.
Nor I.
So it is a late item, so depending on the pre-fiscal meeting, they were put in that tab. It is a late item, which is separate. It's 21-361. I do have a copy if you need it, Representative Edwards.
Thank you, Mr. Kane. I'm a little reluctant to take this item up if it's a late item, simply because of the very recent history of the Executive Council adding a controversial late item to bypass public notice. And if we don't need to
If-
discuss this
yeah,
today,
if you will
I just as
excuse
soon
me,
move
please.
to table it.
This was an error on the part of DAS. This was into DAS in plenty of time. It got shuffled under some paperwork, which I can't imagine DAS having any paperwork. But the result was that it had to enter our agenda as a late item because of the problems encountered in DAS. HHS had in fact sent this over in plenty of time, and it was basically an administrative error on the part of DAS as to why it is a late item. It was not a late, what we would, yeah, it was not a late submittal. It went on time, but just didn't get acted on because of that. So, thank you.
So, Madam Chair, is it your position that because it was an administrative error, there's no public interest in having received due notice of this voting item?
I believe this was posted on the website on what day, Mr. Kane?
I'd have to go back with the beginning of this week. My guess is on Tuesday it was posted to under late items and additional information on the LBA website, which is the second column in that grid. Correct.
Okay, thank you.
Question.
Yes, is this a question for, okay, well, the folks from HHS?
No, it's a question for either Mr. Kane or yourself.
Oh,
Madam
okay,
Chair.
I'm sorry.
Procedurally. So does that posting on Tuesday comply with the state laws for giving due notice to the public?
It does.
Thank you.
I would move the item.
Okay, thank you. Well, we have a motion to table, right? Did you make that motion or not?
Being informed that this has been legally noticed, I'll withdraw my tabling
Okay.
motion.
Thank you.
I would move the item.
Okay, Senator D'Alessandro moves. Do I have a second?
Second.
Senator Rosenwald seconds. Okay, now we have a question. If we could ask HHS to come forward, please. Oh, you okay?
Yeah. I still have one lung.
It's not a good thing. Yes, Senator Daniels.
Thank you. Being that these are 100% federal funds, what are the restrictions or the strings attached to taking this money, and in particular on information that has to be reported back to the federal government?
So these funds are 100% ARPA funds, and if I might also mention, the purpose of this is exactly the same purpose as the FEMA item that was approved earlier. These funds are for the contract for the at-home testing. These are ARPA funds that are coming from Gopher, so I believe that all of the details on the federal requirements have been provided by Gopher previously, but these are the funds that are more the generalized funds that were granted to the state and Gopher manages and distributes.
Do you follow up?
Yes, go ahead.
Correct me if I'm wrong, but the $2.7 million that we previously approved was actually an agency transfer. It didn't state that it was 100% federal funds. It stated it was an agency transfer.
Yes, so those are FEMA funds, which are federal funds, but they come to us through the Department of Safety, so they are labeled as interagency funds, but they are federal funds to the Department of Safety and interagency to us.
Okay, thank you.
Are there any further questions? Seeing none, will the clerk call the roll? Oh, wait, do I have a motion? Yes, yes.
We have a motion.
Right,
Yeah,
there's a motion.
okay, I'm sorry.
Okay, motion to approve. 21-361. Representative Edwards.
Yes.
Clerk votes yes. Representative Erf.
Yes.
Representative Leishman.
Yes.
Senator Daniels.
Yes.
Senator Morse.
Yes.
Senator Gaida.
Yes.
Senator Rosenwald.
Yes.
Senator D'Alessandro.
Yes.
Representative Umberger.
Yes.
Madam Chair, the vote is 10 to 0. I'm sorry.
That's okay. The vote is 10 in favor, none opposed. Okay, now we'll move to tab 11. No, we did that under 10.
I had it under 11.
Okay, well, you told me it was under 10. So it doesn't matter. We passed it. Okay. All right, so now we are in tab 11. And I would like a motion to accept. That's okay. I'd like a motion to concur with FIS 21-343 and 21-250. I got to get my eyes checked. 350 on the consent calendar.
So moved, Madam Chair.
Thank you, Representative Leishman. Do I have a second?
Second.
Seconded by Senator Daniels
What was the motion? I'm sorry, I was
to accept,
343 and 350?
yes, on the consent calendar.
Okay.
All those in favor, please raise your hand. Ten, 0. Thank you. Okay. We now move to, under tab 11, FIS 21-353 from the Department of Health and Human Services. So if I could ask the folks from Health and Human Services to come forward.
Who removed it? Oh, okay. Okay. All right.
Okay, I will take the minutes that I am the one that requested removal. So if I could, I would like you to please reintroduce yourselves.
Karen Rounds, Chief Financial Officer, DHHS.
Good morning. This is Patricia Tilley. I'm the Director of the Division of Public Health Services in the Department of Health and Human Services.
Thank you.
Lori Shibanek, Commissioner.
All right, thank you. I believe that we have a number of questions dealing with this particular request. So who would like to start? Representative Leachman.
Thanks, Madam Chair. First, I'd like to thank you folks for the detailed explanation that was provided. I know in the past we've been somewhat critical in not getting all the information from different agencies, but this is a good example of how it should be done. So thank you for that. But going through it, I did have a question on page 3. What is a subrecipient monitoring? What is that? I didn't see it in your handout. Maybe I skipped it, but what is that specifically?
Sure. So subrecipient monitoring is when we provide funds to a contractor and they are acting on our behalf. And the federal government requires us to monitor those contractors differently than, say, a contractor that we ask to paint a wall. So somebody that's delivering services that are statutorily required by our department or federally required by our department to provide, those are subrecipient contractors.
Thanks.
You're welcome.
That's all I have for the moment, Madam Chair. Thank you.
Are there any further questions?
I have a few.
Representative Edwards.
Thank you. I want to talk about the vaccine registry, and I want to talk about it in the context of what HHS oversight produced on November 1st relative to a request of DHHS to do privacy impact assessments on critical information systems. There's a tremendous amount of public interest in what we're going to be doing with this registry. And so I'd like to ask if the department has undertaken the development of a privacy impact assessment for the vaccine registry.
Thank you, Representative Edwards. So we have not currently begun that particular process to do a privacy impact assessment on the immunization information system, which we also call the registry. I will note, however, that the development of both the statute that authorizes the immunization information system and its administrative rules have been a long time in development. Over 10 years, over a decade of work has gone into the development of both the statute and the rules. We're certainly happy to look at those other requirements as recommended at your committee, but we have not done that to date.
Is the system set up so that it'll be an opt-out, or must it be an opt-in?
It is currently as per the statute, is currently an opt-out system.
Okay, so for all those people who are deeply offended by an opt-out procedure, it's just something we have to accept if we go ahead and fund this.
Currently, the way the system is developed, we operate it fully within the context of the law that it is authorized in. I will note that our opt-out system acts very much like an opt-in in other states that have thought about opt-in, because we do require to be notified when information is going to be put into the registry. The provider is supposed to notify the patient and provide an opportunity for them to opt out at that moment.
Can I make a request that if we approve these funds, that you'll work with Mr. Wieters to figure out how we could do a sound privacy impact assessment on the vaccine registry? I would appreciate your commitment to it, because I do think it's a vital piece of public transparency.
Madam Chair, a point of order.
Yes.
In a recent letter from the Attorney General, we are not allowed to exact conditions on the approval or disapproval of fiscal funds through this committee. And so therefore, while I respect what Representative Edwards is trying to do, I think it's not in order.
So would you like them to refuse my pleasant request, Senator?
I think you cannot conditionalize a vote on a condition that we establish as a committee.
Okay. I did not take that as a conditional comment. I think that from my perspective, he was simply asking DHHS if in fact they would do this privacy study. Is that correct or incorrect?
Yes, it wasn't a condition. It was just saying if we pass this, would they be open to committing to doing a privacy impact assessment?
Okay. Thank you.
If I may, Madam Chair.
Well noted.
If we pass this indicates conditional. Thank you.
Okay. So we will send a request from Division 3 after whatever happens with this vote.
Thank you.
Okay.
And then just to make sure the public understands how the money is going to be used to enhance the registry, I understand there's a couple of main things that takes place with the registry. One is it seems like it's a vital inventory tracking system to make sure that the vaccine supply that's in the state, we know where it's at, we know how it's being maintained, we understand expiration dates, we can track shipment from point A to point B within the state, we can determine our consumption rates and our waste rates. That's a big part of what this registry does, is it not?
That is correct. It really is an accountability mechanism on our part. We are accountable for vaccine that we receive directly from the federal government or from other entities, and then we hold, in turn, when we provide vaccine to a provider's office, say a pediatrician's office, we also hold them accountable for that vaccine as well, and this is the system that does that efficiently.
if we didn't have this IT system, and we've not since 1998, what would we be doing? What kind of waste would there be in the system if we were unable to track it properly?
Certainly. So there's certainly waste in terms of paper. Is one of the big ways that we have been moving. We've been running the program for a very long time for immunization, is really paper records moving back and forth, and I think many of us would agree that that is currently inefficient. Right now, with most of our providers who have electronic health records or electronic medical records, EHRs, EMRs, they're putting that information in their system. It would be more efficient for them to then have a connectivity to our immunization information system. That's something called an HL7. I don't have the same technical expertise as you, Representative Edwards, but I know enough that that allows one system to be able to talk to another system in the most secure and accurate way. And that is what much of this funds is going to right now, or what we would hope to, is to be able to help that connectivity so that we can get information efficiently, effectively, and securely between entities.
I have more follow-ups. I'm sorry, I should have been
Okay.
asking each time.
Let's let someone else, and then I'll come back to Representative Edwards.
Okay, I
Okay.
have about, just so you know, I have like 3 or 4
Okay,
more on
that's
the
fine.
fax registry.
That's fine. Are there any other questions? Senator Morris.
Yeah, Madam Chair, I've participated in 3 meetings this week, and I thought we were going to start this meeting today with a presentation by the department. One of those meetings, after everyone submitted questions, was very helpful in understanding the 2 parts, the $18 million, number one, on the contracts. So it may answer a bunch of these questions if that's the way we handle this.
Thank you. So thank you, Senator Morris. So
Okay. Yep. No problem.
great.
Okay. Yes. Please go ahead.
Great, thank you, Chair. So I think what I could do is provide a very basic overview, and I appreciate the question, Senator Morse. This funding really does 4 major things. It provides some staff to the Department of Health and Human Services to manage the grant, do a little bit of communications, a little program management, but more importantly, it provides 10 individuals to help us with our data. And those individuals are going to be working directly with our pharmacies, with our healthcare providers, as they onboard this connectivity to our immunization information system, the IIS, or the registry.
Could you just explain what you mean by onboard?
Sure, great, thank you.
Not everyone understands that term.
Thank you for the question and the request for clarification. So onboarding is a process by which we ensure and test whether System A at a pharmacy, at a healthcare provider, is sending the information it's supposed to send to our system. And this is actually quite a long process. Sometimes it takes several months to get that done because it's a process of testing back and forth. We review the data, we make sure the data is accurate on each side. Most, again, as we know, 49 other states in the country have some sort of registry, and their experience is that this typically takes several years to be able to onboard all of their providers in the community. Unfortunately, in our case, when we were ready to go, after our statute was in place, our rules were in place, we were hit with sort of a 1-2 punch. We were ready to go with our registry, and we were hit with a COVID-19 pandemic at the same exact time. So the urgency of our work is greater than ever. So that is what onboarding is. It's the process of data testing, where we work intensively with folks in the Department of Health and Human Services, with the IT specialists in a number of providers' offices. We've provided this committee with a list of over 400 different healthcare providers that we are anticipating working with. So that's what one of the components of this funding will do, is to provide us with that staff. It's temporary staff. We anticipate needing them for up to about 36 months. Most of them will, hopefully, as we finish that onboarding process, we will no longer have the need for that same number of staff moving forward. The second thing that this funding does is it provides funding for actually data system enhancements. So again, we talked a little bit about HL7, that onboarding process, so it provides some funding for that. It also provides funding for data enhancements for things like managing temperature control, ensuring that we've really got a good bead and we can be accountable on not wasting any of the vital vaccine that we have. Again, this is not only COVID-19 vaccine, we're also talking about vaccine for basic childhood immunizations, polio, measles, mumps, the sort of infectious diseases that most of us have never really encountered because of the effectiveness of vaccine. It will also do data enhancements that will help providers or people out in the community, folks like school nurses. School nurses will have the opportunity to have a special module that they can use because they are required to, and mandated by law, to ensure immunization of the students in their schools, or that at least we have record of that immunization. This will, one of the pieces we hope to fund would be a portal specifically for school nurses so they can see just their student population as mandated by the statute and by rules. The third thing that this funding does is it puts resources directly into the hands of our healthcare providers. There are resources available for hospitals. There are resources available for unaffiliated healthcare practices. We had a question from the committee about what does the New Hampshire Medical Society have to do with this? And so we have determined that we would like to work closely with the Medical Society so that they in turn could work with those unaffiliated practices, those practices that are not part of big hospital systems. We're going to be working with those big hospital systems, and we're going to also be working with other pharmacies and others to ensure that they have the resources they need to be able to administer vaccine, do the IT work on their end with their EHRs, and ensure the accountability of that vaccine. Again, things like refrigerators, temps, managing that within their offices. The fourth thing that this project does, or these funds will do for us, is a little bit of education. And that's education and ongoing communications over the course of the next 3 years. Some of that is peer-to-peer learning between physicians and other physicians so that they can share information more effectively. As many people know, we currently at the department do twice monthly calls with our providers. We think moving forward over the next few years, some of that work will be better done from physician to physician through Dartmouth or another entity. So we would like to support that. We also have additional funds to doing other communications so that we can provide educational materials to our healthcare providers that are available in all the languages they need them to be and that address the questions that I know many people in the public have. So I think that's a high overview of the 4 main points of this funding.
Thank you very much. So were there any other questions other than the follow-ups that Representative Edwards has?
Madam Chair, I would, at the end of the question period, like to make a statement.
Okay, fine. Representative Irf?
Thank you, Madam Chair. Can you point me to where in the RSA 141C20F that it says it must be an opt-out system? When I read the registry, that law from 1998, it doesn't seem to require it be one way or the other.
I don't have the statute in front of me right now. I have the rules in front of us where it does speak to that.
I understand the rules state that very clearly, but the rules are not the legislation. Could you clarify where in the statute it says that?
If I can pull up the statute in a minute, I can help point you to that. I just don't have it in front of me.
Thank you.
Take your time, no problem.
I'm not sure that I have the statute in front of me as I look through my notes.
Oh, okay.
I can give it to you if you'd like.
If you have it on your computer, I'd be happy to look at it. If that's okay with the chair.
That's perfectly all right. You can just come up. Oh. Yeah. Well, we're not going to let her go away with your computer. Don't worry about it.
Do you have other questions that we can answer while I'm looking this up?
I think it's right there on the screen.
No, any other questions? So I can take a minute to read. That's why I was asking.
Okay.
So,
Okay.
So, yeah. Roman numeral 6C, and that's what I was just looking. It is the procedures for the patient or the patient's parent or guardian, if the patient is a minor, to decline to participate in the registry. That is what we have interpreted as an opt-out.
Fair enough. I guess I'd like to, and not now, but I'd like to hear that from an attorney, because it seems to me that the primary place, it's okay, the primary place where where that came in was in the rulemaking, and I totally agree that that's in the rulemaking, but if it really is just in the rulemaking, then it would be possible for you to change that without any legislation.
Okay, we'll,
We would need attorney and counsel to tell us that.
okay. All right. Anything else from anyone? So Jess, you had, I'm sorry, Representative Edwards, you had some additional questions.
I do. Thank you so much. So, okay, so Representative Irv kind of kicked off the next area I wanted to get into about the VAX registry, and that is this is the portion of the registry that has the public the most interested and to some extent upset is they believe that there was a requirement for us to collect some personal data and to transfer that personal data to the federal government. And there's this lingering perception that we opted to over-collect personal data well beyond what the federal government's requirements were. And so the belief is that New Hampshire is surrendering patient privacy that we really had no requirement to do so. And I was wondering if you could speak to that, of whether or not we are strictly limiting the collection and transfer to the minimum essential data set required by federal statute, or alternatively, have we decided individually to enhance that data collection?
Thank you for that question. So in terms of what we send to the CDC, specifically around COVID-19, we actually send aggregate data. They have asked us for individual line level data. We, as the Department of Health and Human Services, have sent them aggregate data, so in fact, less information than the federal government required.
So thank you for that. Could you speak to the other part of it, though, which is, are we in our database intending to collect more data than what's required by the federal mandate? Are we, for our own purposes? Are we over-collecting?
Are you asking in terms of, are we over-collecting for the information that we need here within the Department of Health and Human Services, not that we're sending out? Is that, I'm trying to clarify.
Basically, you're saying what we need. I would say what we want, but it's a semantic.
Great. I would have to, I'm not prepared right now to do a line by line of all of the data elements. I'm happy to do that. If we had had that question earlier, I could have been well prepared for that.
Sure. I've been sick, sorry. One more set.
Okay.
This is about the personnel. As you know, it's been my point of view that we have a severe workforce shortage in New Hampshire, and already today we've approved 4 or 5 additional slots for the department, and here's a big chunk of 13 more people. And it just brings up questions to me of where are we going to get these people? Can we really get them? Should we be trying to pull people out of the private sector now and putting them into government bureaucracy jobs?
We don't need a lecture, or just what is your question, please?
So my question is, Mr. Kane, would you help me form a tabling motion to table the 13 positions that are in this?
Sure. So a couple options available to the committee for motions. If it was the intent of the member to pass the funding but not the positions, they would move to adopt 353 item 1 only. and to deny item 2, which establishes the positions.
Okay, so I would like to move that the committee adopt item 1 on 353 and not item 2, and I can speak to that motion.
Okay, I need a second. Seeing none? Oh, okay. Senator Morris, seconds. You may speak to your motion.
Okay, Madam Chair, this is representative of a long-standing issue with our workforce crisis here in New Hampshire. I just see that we keep adding more and more and more bodies on paper where I just don't know where we're going to get them from, and even if we can get them, I think we're doing damage to the private sector by pulling human resources into the government. So rather than commit to bringing in yet another 13 people, I would just as soon let the money that would be allocated for those people be used for the other programmatics. I'm not saying we should cut the money, but I am saying that there's I'm not enthusiastic at all about adding 13 more people at this point.
Thank you. Are there any other discussion on this? Representative or Senator Morse?
Yeah, thank you, Madam Chair. In fairness to the representative, he brought this up to me earlier today, and I do have concerns about vacancies in all our departments, not just this department. And I said that to the representative, and I said, I think that's something that the legislature is going to have to address in January, because if we have a 15% vacancy running in Health and Human Services, that's a lot of money. And, you know, we could have wrote the check for this, quite honestly, but I think that's something the legislature definitely has to come back and look at as we get into January, along with the fact that I've asked for a look at the CAFA to see how much money's left over from last year that I want to talk about. You're headed down the same pike that I think the Senate would go down. On this particular item, I'm not sure I accomplish anything by supporting you on not putting these 13 positions in when we're talking about 3,000 positions, Jess. That's the only thing. So I guess at this point I'm not prepared to go with that motion.
I appreciate that. I just am a believer that when you're in a hole, you just quit digging.
Are there any other comments on this particular motion? Okay.
Can I ask for an explanation for Mr. Kane? So does this mean that we are, if this passes, we'd be accepting Part 1 and not Part 2? In other words, it'd be a final vote on the whole package.
That is correct.
Thank you.
Madam Chair, can I withdraw my second, and that'll solve that problem?
Yes, you may. Okay, Senator Morris withdrew his second. So, Senator Gaida, did you want to say whatever you wanted to say now?
I think that would be appropriate, Madam Chair. And
Okay,
I
fine.
thank you, and I thank the committee for its indulgence. President Ronald Reagan once said that freedom is never more than one generation from extinction. We didn't pass it to our children in the bloodstream. It must be fought for, protected, and handed out for them to do the same. Or one day we'll spend our sunset years telling our children and our children's children what it was once like in the United States where men were free. This Fiscal Committee item has precipitated an incredible amount of public sentiment in opposition. And it may well be a defining vote for those in elected office, those on this committee, and is therefore deserving of our most careful scrutiny. The department is doing what it believes it must do. Its mission, and I quote, is to join communities and families in providing opportunities for citizens to achieve health and independence, end quote. And its intentions are understandable. But we are not the department. We are the elected representatives of a people that entrust to us their freedom. and the freedom of their children and of future generations of people in New Hampshire. As with all of us, my mission is, and I quote, to faithfully and impartially discharge and perform all duties incumbent on me as a state senator, according to the best of my abilities, agreeably to the rules and regulations of this Constitution and the laws of the state of New Hampshire, so help me God. To us falls the obligation of holding government accountable, of protecting and defending first and foremost the freedom of our citizens against the inevitable erosion that government is capable of producing, no matter the beneficence of its intentions. Our founding president, George Washington, made the statement, "Government is like fire. It's a wonderful servant, but a terrible master." Implicit in that statement is something that we as legislators often forget. Okay? Whether a program infringes on the natural and constitutional rights of our citizens, but we as the elected guardians of the right to life, liberty, and the pursuit of happiness bear the grave responsibility not only to look at the efficacy of programs, but their actual and potential impact on the freedom of this and future generations. Before us today is an item in which the contract under consideration clearly articulates that the federal government can, and at an indeterminate time in the future, may impose limitations and conditions on this government and the people of New Hampshire. With all due respect to the opinion of Attorney General Formella, a distinguished legal scholar, I'm sure, that the terms of the contract under consideration are not enforceable, and aware of the legal impotence of the non-binding resolution adopted by the Executive Council, it falls to this committee today to weigh the potential benefit of increased government efficiency in managing the details of an executive order that is under review for its constitutionality and the constitutional rights of that order as they affect the citizens of our state. I have served my country as an officer of Marines in places you cannot mention, in places you cannot pronounce, okay, and done things in the interests of our country. I've served as an FBI agent. I have seen the abuses that government can perform. I had the privilege of captaining incredible engines of commerce around the world. I have been in China. I've been in Hong Kong. I've been in Pakistan. I've been in Venezuela. I've been in all the places where government has gradually and ultimately completely encroached and destroyed the liberty of its citizens and the economics of their countries. I've been in China, where the government monitors and assesses the worthiness of citizens to partake in the benefits it doles out to them, where it decides whether or not citizens are deserving of employment, whether it decides how many children a family may bring into the world, where it controls every aspect of the lives of the people over which it rules. We'd like to believe our government, our federal government specifically, wouldn't do such things. Our federal government would never weaponize the IRS to audit those who differ in their political views, but it did. Our federal government would never order a sniper to murder Vicki Weaver, an unarmed woman with a child in her arms, based on warrants that were replete with misinformation, but it did. Our federal government would never ambush and kill a nonviolent man driving to meet a sheriff in the Malheur National Forest, but it did. And our federal government would never threaten to weaponize the FBI against parents who want their children educated and not indoctrinated, but it did. Our federal government would never force a person to take an experimental injection against their will as a condition of employment or continued service in the military, but it did. The contract before us states that data collected by the state is de-identified and aggregated before being sent to the federal government. But we have to ask ourselves, in the first instance, why is the state government even collecting this data, individually identifiable, to begin with? And why are the private entities giving these shots, automatically sending detailed personal data to the federal government? Under the terms of the grant under consideration, the department states the data is de-identified and aggravated. I agree. But under the terms of this very same agreement, the protection remains only until the CDC or another federal entity requires the disclosure of that identifiable data at some point in the future and for some purpose unknown to us and utterly beyond our control. I have no problem with what we're trying to do. I have a problem with the federal government. And the contract that will be signed as a part of this grant gives them unquestionably the authority to change the rules without a word out of us. The action we take today will be historic. It will be historic because we will either reject the notion of subservience to government coercion, or it will be historic because we accede to that notion and violate the most fundamental premises of freedom upon which our state and nation were founded, and which are imperiled as never before us in our nation's history. I think you have a sense of where I'm going to vote on this, and I thank you for the indulgence of providing me the opportunity to speak, Madam Chair.
You're quite welcome. There will be no outbursts from the audience. Okay? So if you would, thank you very much for quieting down. Okay. Are there, Representative Daniels?
Thank you, Madam Chair. Of the 500 to 600 emails that I have received on this item, 84% were against it. And they were against it for primarily two reasons. One of them was the sharing of data, the collection of data, not knowing where it's going to go. And through just the discussions we've heard today, it would be known by the contractor, the state, the CDC, and even private organizations like the Medical Society. The problem is that when government at any level starts collecting our data, we tend to lose our individual sovereignty. And therefore, we begin to distrust the government that's supposed to be working for us. To carry on, we also are asked to sign this contract. It's a blank piece of paper that says that you are agreeing to whatever we, the federal government, are dictating now and in the future. We don't know what that's going to be. That's exactly the reason we turned this down 2 months ago. There is nothing in this proposal that has changed from 2 months ago, except that you're adding one more position as a program manager. I don't think there's anyone in here that would responsibly sign a piece of paper for a job or anything else, not knowing what is going to be written on there that you're going to be held committed to. For that reason, I will be voting against this. I don't see any reason that I should change my vote from what it was 2 months ago when we tabled it. I was hoping to get more information, particularly, I believe a comment was raised before. We'll take the language out. And the answer was we can't do that because it's federal language. We have a letter from the Attorney General saying that, well, the language in there doesn't mean what it means. If we treat every piece of legislation in the same way, then what are we doing by passing legislation and somebody interpreting it that we don't really mean what we're saying? So if we're going to get back to basics and start putting things, and if it's in black and white, understanding that that's what it means and that's what's going to hold up in the court of law, then we ought to be voting against this proposal. Thank you.
Please, I don't want to have to ask you to leave. Okay. Representative Emmerich, could I don't have a motion.
I would move the item.
Who is that? I'm sorry.
Senator Lou D'Alessandro, I move the item.
Thank you. Do I have a second?
Second, Madam Chair.
Okay, second from Representative Leishman. Okay, will the clerk please call the roll?
It's a roll call on 21-353. Representative Edwards.
No.
Clerk votes yes. Representative Earth.
No.
Representative Leishman.
Yes.
Senator Daniels.
No.
Senator Morse.
Yes.
Senator Gaida.
No.
Senator Rosenwald.
Yes.
Senator D'Alessandro.
Yes.
Representative Umberger.
Yes.
Madam Chair, the vote is 6 yes and 4 no.
Okay. FIS 21. Thank you. Okay, moving on to tab 12, please.
We the people. This is New Hampshire. Live free or die. Shame on all of you.
I do not want to have,
On you.
I do not want to have to remove you from this room, but another outburst.
Here. How about that? Our children live here.
All right, thank you.
How dare you?
Could I ask Protective Service to please escort the young lady out of our room?
You don't need to.
Okay, thank you.
Sleep well tonight, and God forgive you all.
Okay, we now move on to tab 12.
Madam Chair,
Yes,
might we take a 5-minute recess?
certainly. Okay, we'll recess for 5 minutes, please.
Okay.
Okay. I am calling the Fiscal Committee back to order. We still have some additional business to accomplish. So, the first item on the, since we have recessed, is FIS 21347, which is on the use of tab 12, on the use of state-owned passenger automobiles. Are there any questions? Yes.
Would it be appropriate to move tab 12, 13, and 14 at once?
Because they are such diverse items, I thought it would be better to handle them separately in case someone has questions. Okay. Are there any questions on 12? FIS 21347.
I move the item.
I'll just write it here. I'll write it here.
This is the vehicles.
Okay. All right.
Second, Madam Chair.
Okay, thank you. The motion was to accept was by Senator D'Alessandro, seconded by Representative Leishman. Okay. Will the clerk call the roll, please?
A roll call for item 21-347. Representative Edwards.
Yes.
Clerk votes yes. Representative Erf.
Yes.
Representative Leishman.
Yes.
Senator Daniels.
Yes.
Senator Morse. Yes. Senator Gaida.
Yes.
Senator Rosenwald.
Yes.
Senator D'Alessandro.
Yes.
Representative Umberger.
Yes. The next item on the agenda is FIS 330, which is a request from the Fish and Game Department to transfer money.
Move the item.
Second.
Thank you. Senator Gaida moves. Senator D'Alessandro seconds. Will the clerk call the roll, please?
Roll call on FIS 21-330. Representative Edwards.
Yes.
Clerk votes yes. Representative Erf.
Yes.
Representative Leishman.
Yes.
Senator Daniels.
Yes.
Senator Morse.
Yes.
Senator Gaida.
Yes.
Senator Rosenwald.
Yes.
Senator D'Alessandro.
Yes.
Representative Umberger.
Yes.
Madam Chair, the vote is 10-0.
The vote is 10-0. We now move to tab 14, which is FIS 21344, fees for the park system. Could I have a motion to accept?
I would move it.
Thank you, Senator D'Alessandro. Do I have a second?
Second.
Second by Senator Rosenwald. Will the clerk please call the roll?
Madam Chair, I just have a quick comment.
Oh, yes. Okay, sorry.
Oh, not a problem. I'd just like to say this is another,
Could I have someone up from...
it's just a comment on
Oh, okay.
I think this is just another good example of a good job done as far as a thorough explanation, and thank the department for that.
I agreed wholeheartedly. Okay, will the clerk please call the roll?
This roll call on 21-344. Representative Edwards.
Yes.
Clerk votes yes. Representative Erf.
Yes.
Representative Leishman.
Yes.
Senator Daniels.
Yes.
Senator Morse.
Yes.
Senator Gaida.
Yes.
Senator Rosenwald.
Yes.
Senator D'Alessandro.
Yes.
Representative Umberger.
Yes.
Madam Chair, the vote is 10-0.
The vote is 10-0. I need a vote on this one, right?
Yes, so under tab 15 is a request by State Treasury to release, when available, the college tuition savings plan audit as well as the 529. So just a motion to approve is appropriate.
So moved.
Second.
Senator Gaida and Senator D'Alessandro.
You did this in a roll call? Roll call on 21-326. Representative Edwards.
Yes.
Clerk votes yes. Representative Erf.
Yes.
Representative Leishman.
Yes.
Senator Daniels.
Yes.
Senator Morse. Yes. Senator Gaida.
Yes.
Senator Rosenwald.
Yes.
Senator D'Alessandro.
Yes.
Representative Umberger.
Yes.
Madam Chair, the vote is 10-0.
Thank you. The vote is 10-0. We now move to the information items. And I just wanted to commend the Department of Administrative Services for FIS 21320, which is the quarterly status report of state fund expenditures in the last fiscal quarter. I thought it was very clear, concise, and understandable. So thank you very much for that. The other thing that I would like to do before I turn this over to anyone that might have questions is to, if you will turn to tab 16, there is a commendation for our audit division from the National Conference of State Legislatures through its National Legislative Program Evaluation Society. And the LBA Audit Division was issued a certificate of impact for its 2019 performance audit on the Department of Health and Human Services Therapeutic Cannabis Program. So I really think that this is a great recognition for our LBA auditors, knowing that they do a great job. And I just wanted to make sure that everyone was aware of the good things that that our LBA does for us, and that they are nationally recognized.
Thank you.
Are there any other questions on the information items? Okay, I do have one, and that is on, it's your DHHS on your chart. I don't know what the chart number is, but it shows number of positions filled, and we're down below 2,700 on that, and it looks like we took a pretty steep drop in at the beginning of the fiscal year, and my concern is, I think, as Representative Edwards identified, and as many people sitting here are concerned, that we're just not able to hire, I guess is the right term, unless something has happened over the last 3 or so months. That obviously this chart ends in July. So if you could just address what's going on with our hiring.
Sure. So I guess I would ask Lori Weaver to come up to talk a little bit about hiring. But just a clarification on the chart. The straight line is back from 2018. This chart had not been updated for years and years and years. And part of the HB1 legislation that reduced the number of funded positions in the department required reporting on keeping positions under 3,000 filled positions. So I brought this chart back to life and started putting those numbers on there.
Okay.
So that's why you see that weird drop. It's artificial.
Okay.
The other thing I would just say, while you've given me the opportunity, to Senator Morse's point earlier about position lapse, I don't think that DHHS will have a lot of position lapse, although we do have a lot of vacant positions because of that footnote in HB1 that reduced the budget by 22 million or so, or over the biennium, it was 22 million, I believe, in position lapse. So I think that that is going to be a majority of our position lapse. There will be some, and I think hopefully the note is still on the cover page. I won't be able to provide lapse information until January. It's not accurate until we have at least 6 months of data. So I should have something, if not for the January meeting. I could report out on it at the January meeting. It'll be on the dashboard for the February meeting.
Okay, that sounds good.
Madam Chair, may I ask a question?
On this issue?
Yes.
Okay.
Thank you very much. Could you tell me if the department, as a condition of employment, is requiring the vaccine? And are there any positions for which it is required, but not for all of them?
We are not requiring vaccine to be employed by the department. There is a question mark on some of our healthcare facilities on whether the CMS mandate is going to impact them, mainly New Hampshire Hospital and Glencliff Home. So as you know, and the Attorney General could speak more to this than myself, but we have signed on to the lawsuit contesting the mandate, both the CMS and the business mandate. So we're waiting to get more information from that lawsuit.
I want to thank you for everything you're doing and can still do in the future to protect bodily autonomy. Thank you.
Okay, please, go ahead.
Hello, my name is Lori Weaver. I'm the Deputy Commissioner of the department. You were asking about retention and workforce?
Well, I'm asking about hiring.
Hiring.
Yeah, I mean, I realize
Well, I think
retention goes with it, but...
Sure. Unfortunately, I think we are in the same boat as many other state departments and agencies that we face hiring challenges. Over the last year, we've had an average of a 20% aggregate, so that would be across the department and all divisions, 20% vacancy rate. So as soon as we fill positions, they may vacate on the other end. We have about 50% of our population in the department of staff is about direct care positions. So those are folks that are out in the field servicing our citizens, meeting with families, children, adults, what have you. Those have been particularly hard to fill during the time of a pandemic. A lot of folks don't want to put themselves at risk going out into communities and into homes. So we even have vacancies in our human resources department. So even that has been a challenge. We've gotten creative. We've spent some money with different kinds of recruitment, different kinds of advertising, working with schools and colleges. We just did the Manchester Community College Fair a couple of months ago, looking at high school students coming out of high school and working in the department, trying to look under every rock possibly that we can to find people. The thing that keeps people at the department is that we're a mission-driven organization, so people come to the department because they want to serve and they want to help the citizens of the state, and we've been trying to market that as much as possible to find those folks too, but a lot of other people are looking for them as well. So we have not given up on our efforts, but unfortunately, as soon as one fills, another one vacates.
Right. Okay.
And if I could just add that 20% includes unfunded positions.
Thank you, Karen.
You're welcome.
Oh, okay. All right, are there any other questions for HHS? Seeing none? Fiscal is over. I'm sorry. Fiscal's not over.
Thank you. Madam Chair, first I'd like to thank you. I know you've had a very trying week. I've been alongside you in many of those meetings to be able to get the information that we believe we needed this week to be able to vote on an item today. So thank you for all that you've done to get us the answers to questions. Beyond that, I'd also like to say I know the House faced the same challenge that the Senate faced. I know with Senator Guider, I was on the phone with him Wednesday night. telling him that if he wanted his vote represented, he needed to get back on a plane, and he told me he'd let me know that, and he did. And he came back here today. And I know in the House they had the same issue. I've been very, very upfront about the fact of what I believe in the Fiscal Committee. I mean, you all get $100 and I get an extra 25, and we come to this committee and we actually read this book. Yeah. And the reality of it is, I think it's made HHS better. I think the presentations this week have gone beyond where they normally would be, and I think it made it so that we can make decisions. But I'd also like to be very clear. I took the same oath to the Constitution of New Hampshire and to the country. And while I sit here, there is no doubt that when I make decisions, I make them the same way you do, Bob. I make them believed on the fact that I'm doing the right thing because of my position in the New Hampshire Senate. And I know you respect that, and I just want to make that clear. Thank you, Madam Chair.
Senator D'Alessandro.
Thank you, Madam Chair. Madam Chair, I'd like to do two things. First of all, I would like to reinforce what the Senate President said. Kudos on the way you've handled the meeting and the way you people have gone through the week in preparation for this meeting. I'm truly impressed by the way you handled the crew. So you get a bonus for that. You're not going to get another $25, but if we take up a collection here, we might be able to come up with that. I take an oath. I've been here a long time, and we all do the best that we can, and we respect everybody else's opinion, and I think that's extremely important. I think communication is the key. We've had better communication. I spoke about communication a couple of meetings ago, and I think it's improved. We can do a much better job if we get good communication, and that means good information in a timely fashion. That makes us better legislators, and I think that's forthcoming, and it's been part and parcel of the process. And the last thing, I sent you a notification saying I was going to say this. I talked to Senator Daniels about this also. I think when we ask a department head to be here, that department head should be here. We need that. Senator Daniels explained to me why a particular person wasn't here. I appreciate that very much, the work that you did. But indeed, the department heads serve the legislature. When a department head is asked to be here, that department head should be here. People have questions. There are times the only person that can accurately answer those questions is the department head. So I want to make that point emphatic.
Okay.
Thank you.
Yes. I think that I jumped ahead of myself, but I think that based on your comments, Senator, that I will delay the education comments from today and reschedule them for our next meeting, which I believe is December 17th.
17th is the third Friday of December,
Right.
correct?
Is that okay?
Yes, thank you, Madam Chair.
All right.
Appreciate that very much.
And I know that our DOE folks will take that message back. And if there's any question, the commissioner can give me a call. So, is there any other business that I have managed to forget?
Just happy Thanksgiving to everyone.
Yeah.
That's it.
Yeah.
Yes.
Happy Thanksgiving to everybody, and I thank you all for your hard work, and I thank our two members that were so interested in the topic today that they cut short their vacation time with their family. So I appreciate that very much. So, okay. Thank you all, and we'll see you on December 17th, if not before.
Thank you.
Can we take our books? Oh, it's here.
Yes.